Hey everybody, welcome back. This is Mike Banner for another episode of 62 Who Knew. And we welcome back today one of our national sponsors. Just here a month ago, Ms. Diane Daniels, a national expert on all things Medicare. Welcome back, Diane.
Hey Mike, it's always good to be here.
It is.
Especially when we have good topics to talk about.
Today's topics or topic, although there's many different subtopics in here, hits close to home because, as you know, I just lost 55 pounds and I have another 30 to go. But obesity in this country is on the tip of everybody's tongue. Well, so is their fork and their dinner. That's the problem.
Exactly right.
That's how their obesity is. But let's talk about the things that are affecting everyday America. I mean, I keep hearing this term. It sounds terrible. Fat drugs. What are the fat drugs that are being discussed pretty much everywhere?
Well, if we just use that term fat drugs, okay, it kind of encompasses a lot of stuff. All right, so you could think about prescription drugs. Mm-hmm. You could think about dietary supplements, right? Mm-hmm. You can think about commercial companies like Weight Watchers, Jenny Craig. Mm-hmm. You could think about, medical oversight with clinics and doctors that have weight loss programs and things like that. So there's a lot involved in fat drugs mm-hmm. by itself. And that's why we need to talk about it, because take a guess, how much do you think Americans spend on weight loss? All of the, things I just talked about. What do you think they spend a year? Close to, estimate.
Hundreds of millions?
90 billion would it be?
That's unbelievable.
No, it is true. This is what we are spending on weight loss products, prescriptions, supplements, programs, all of it. $90 billion a year. So you can understand now why this is so important, because I'll say this to you forever. Every time you and I talk, I'm going to tell you it's about the money.
Yeah.
It's always about the money. Follow the money. It's about the money. This is about the money.
It's staggering, and this will be another show. We were just talking beforehand that I can't help myself once I start talking. So this will be another show. But we're spending over $90 billion on fat drugs when so much of this world is starving. To me, that's a staggering, deep thought, which will be another show for another day. But when you said that, that's the first thing I thought. Mm-hmm. And there's children in this country starving.
Exactly.
And we spend onward and offward. Keep going.
All right. So when we're talking about now, right now people are hearing this and they're saying, yeah, but currently, and I don't want to use the word fad, because we're just in a transition phase with drugs that are used for weight loss, and they're tied to this GLP-1. This is everything you're seeing on TV, all kinds of commercials, right? And it stands for glucagon-like peptide. That's the technical medical term. I'm not going to get into it. I'm not no freaking doctor, okay? I'm not purporting to be a doctor, but that is what it stands for. And, of course, it's going to help with the release of insulin. Mm-hmm. Okay, so that's where it's tying it in with weight loss. And also, in your brain, you have that appetite. Am I hungry? Am I not hungry? So it helps with that turn on, turn off type of thing. So the GLP-1s are what's going on now. That's what everybody's talking about. Yeah. We're not hearing people talking about Weight Watchers. We're not hearing people talking about.
Look at me. Yeah.
Well, we're not.
Yeah.
Okay, so that is what we're talking about today. These are our fat drugs that we're talking about today.
Right, and people I don't think realize when they're going for their insurance, whether it's health insurance or long-term care insurance or any life insurance, being overweight hits that premium.
Oh, yeah.
It hits that premium hard.
And they don't think that, because everybody will know if they ask you if you smoke. Everybody knows that. If you're a smoker, your premiums are going to be higher. Mm-hmm. But a lot of people don't realize that weight has a lot to do with it also.
Mm-hmm. Now, I take, and I got to tell you, to me, it's a miracle drug. I take a shot of Munjaro every week for the last 12 or 14 months, and it's helped me drop close to 60 pounds. If Munjaro is watching, you'll make my check out to either Michael Banner personally or 62 Who Knew, either one you want. But I have so many friends on Munjaro and other medicines like that. And I tell you, they're expensive. A lot of medical insurance doesn't cover it.
Yep.
And does Medicare cover this type of drug?
Well, so Medicare right now has a really bland blasé way of managing obesity. Okay, I mean, it's kind of terrible. So right now, this is how Medicare covers obesity. You got a problem, you go into the doctor's going to say, you need to lose weight. That's what they tell you, right? You gotta lose a few pounds. It doesn't matter if you weigh 600 pounds or 200 pounds. That's what they say to you. You gotta lose weight. You gotta move a little exercise. So your primary doctor is talking to you, tries to help you with your dietary restrictions, and then tells you got to lose a few pounds and exercise. That's how Medicare is handling obesity management. That's what they're considered to have this high intensive.
I know.
It's terrible.
You're so right, because that's what the doctor said to me for 15 to 20 years until I had a little bit of a scary episode.
Yep.
Ended up in the hospital for a couple of days, and then I was, you can blot this out if you want, Anthony, scared shitless after those 2 days in the hospital. And then I went on Munjaro and went back to the gym.
Yeah.
But yeah, that's their big push. You got to lose a few pounds.
You got to lose a few.
Yeah, I would go out to lunch after the doctor told me that usually.
Yeah, most people wouldn't. I can't tell you how many clients I have where the doctors are very aggressive and they don't have that bedside manner, that people would really want. And I've had many clients call me crying because of the way the doctors handle that with them. They just are very cold, some doctors, no bedside manner, and it's just like, lose the weight. You got to lose the weight or you're going to be dead early, that kind of a thing.
Well, bedside manner sometimes is overplayed because a lot of people, and I guess I was one of them, I wish somebody would have said to me 15 years ago, you're going to be laying in a hospital bed one day soon. And my doctor, who I absolutely love, when I was in the hospital, said to me, I'm not going to scare you. I'm not going to anything. Get used to being here. You're going to live for another 20 years because of modern science and technology.
Right.
But keep paying your medical premiums and get used to this. You've got to lose the weight.
Are you turning 65? Well, if so, the most important decision in your life right now is to determine which Medicare plan you need to be on for your unique changes in life. Are you still working? You on your employer's plan? How about being a snowbird? If so, you need to speak to a Medicare consultant who can help you with your needs. I'm Diane Daniels, and I'm the CEO of Medicare Nation. Go to www.62whoknew.com and click on the Medicare Nation tab. I will give you a free consultation to make sure we find the right plan for your unique needs.
We try never to get political here, but what does our weight control, what does our Medicare look like compared to other countries when it comes to weight control?
Well, the United States, in all of its efforts with prescriptions and weight control, it's about the money.
Yeah, it's always the money.
It's about the money. So just like all of your food products, they don't care what they putting in it, in your chips or in your cookies or whatever. The whole idea is to make it taste good. And I think many of you, whether you're a sweet tooth or a salty person, it's all about how that tastes. So in America, it's just about money.
Yeah.
Okay. And we got to sell the products. And it's the same with drugs too. All right. It's got to be effective. It's got to work. And people just get too used to that with the drugs. And they kind of don't put things together for good weight management. In other countries, there's so many other countries that really care about the entire strategy of weight management as opposed to here. I mean, their entire system, even their educational system is so much different than it is here. They treat their citizens like families. Just like in Japan, they treat their elderly like with the utmost respect. Okay, so different cultures just treat things in a very different manner than we do here in the United States, and it's just like, you don't like it, off. What I'm saying. So
no, I was on a Zoom a couple nights ago with a podcaster from Great Britain, and this subject came up because I knew you were coming on. I said, what's the difference? First we started talking about reverse mortgages because they have a reverse mortgage over there called equity release. And then I said, well, how about Medicare? What's your, and she started to explain things to me about that. And I said, now talk to me about obesity. She said, well, people in America pretty much don't like what we do here in Great Britain. I go, what do you mean? She goes, you would probably call us a nanny state. I go, why? Because Great Britain actually has rules and regulations on what kind of food can be sold in supermarkets and what chemicals can go in them.
There you go.
I go, oh my God, I never knew that. So, and yeah, and some people are against that, even here in their country. But on a whole, they want everybody living longer. And if they're healthier, there's no medical claim, there's less medical claims. And you're right, we don't do that. I mean, no, the commercials that we see for everything, whether it's going back to when we were kids and Lay's potato chips, I bet you just can't eat one.
That's right. They're not kidding.
Yeah. You're nodding your head at that? Do you remember that? You're not old enough to remember that.
Yeah, I remember that.
You remember that? Yeah. Well, you know what? I can't just eat one.
Yeah.
But it's everything. I mean, when you never want to look at the ingredients anymore on stuff that you're eating. But what can we do to stop it? Because in this country, it is all about the money. Is it ever going to stop, or is it going to be up to the government? Is it going to be up to Medicare or Social Security to say, if you're going to continue to do this, we're not going to cover you?
Yeah,
I mean, what is it?
That could come down the line, okay? But again, now we're talking about money, all right? Mm-hmm. And capitalism, the way it is in America. Mm-hmm. So we're talking about the pharmaceutical companies right now when we're discussing fat drugs. Mm-hmm. So right now, we have 3 drugs that Medicare covers, and it's because it is the treatment of diabetes. Medicare does not cover weight loss drugs for the class that is to lose weight. That's what the drug is supposed to do. And let's go back to 2003, because that's when the Medicare Modernization Act was in effect, and Part D for drugs, started. Mm-hmm. Okay? And when that started, Medicare was like, oh, hell no. No weight loss drugs, no drugs for anorexia, weight loss, or weight gain. No, no, no. And that is because of the classification of the definitions and how weight loss was perceived, okay, back then. So in the 1990s, very early 1990, I think you'll remember the name of this drug. You remember Fen?
Oh, Fen was the thing. I took that for a while.
All right. Fen was the thing. Exactly right. Yeah. And that was classified as a weight loss drug, okay? But what happened, people, is that they didn't realize some of the adverse side effects for Fen. And what happened was many people had serious heart valve issues. Serious heart valve issues. Oh, yeah, I remember that. Yep, absolutely. And also some cases had lung issues, hypertension, a pulmonary disease. That's a rare, but it's a fatal lung disease. So by 1997, the FDA was like, out of here. Mm-hmm. All right? And millions of lawsuits.
Oh, my God. Everybody was on Fen. All my friends, myself.
I know a lot of people, too. I didn't take it, but a lot of my friends take it, and I actually had one that has the serious heart valve, complication from the side effect. So Medicare was like, hands off. That is just like showing us, woo, they're not going to be able to come up with something that's going to be effective and not have these serious side effects. So from way back then to today, okay, here we are in June, today, and they're not having it in their rules and regulations about Medicare to cover weight loss drugs. So the classification for Rybelsus, which is an oral medication instead of the injection, okay? Ozempic and Munjaro, okay, are for type 2 diabetes. That's what they are in Medicare for. That was approved for type 2 diabetes. And Medicare covers all 3 of them. So whether you want to just take the pill like Rybelsus or the Munjaro and Ozempic, which are the injections, Medicare covers it. Other weight loss drugs that are out there is Wegovy, okay, and Zepbound, and Saxenda. I'm probably saying that terrible. I'm sorry, pharmaceutical companies. But they are not covered by Medicare because it's classified as weight loss drugs. I just told you since 2003, that's been hands off.
Right.
Okay, in the Medicare rules and regulations because of some of the things like Fen that had happened. So they are not covered right now under Medicare. But just like on Munjaro and Ozempic, and you just said yourself, it helped you to lose 60 pounds.
Yeah, it took away my appetite. It was a miracle to me.
There you go.
I mean, even to this day, I eat because I know I have to. It still hasn't worn off. Now, we have had to increase the dosage. I'll just say that. I started at 2.5 milligrams, then after about 3-4 months went to 5. I just went to 10.
Yep.
But the trick is going to be now, once I lose this last 25 or 30 pounds, and this is the hard part for America, is changing your real lifestyle. It's one thing to have a chemical take away your appetite, but if I gain it all back, which I better not do, I'm too old to gain it all back.
I hear you.
Next stop is not a good stop.
I hear you. But that you just hit it right on the head. So you said that it helped with your appetite, and then that helps you with losing the weight. And it also, whether you know it or not, in your digestive tract is slowing down your digestion. And it is what it's doing on the diabetic side is on the release of the insulin.
Yeah.
Okay. And that's what it's was put into Medicare for on their formulas because of the diabetic function of the medication.
Yeah.
But Wegovy and Zepbound are weight loss drugs, so they're not covered. But what happened was, I am sure that the manufacturer said, if Ozempic and Munjaro have these kind of side effects and it was for diabetes, but they're losing weight, can we find something? So, they're on something, right? So Wegovy, they found helps with the reduction of heart attacks and strokes in people that have cardiovascular disease, all right? And Zepbound, they're finding reduces sleep apnea. So
now we got a back door.
There's the back door. So they are filing with the FDA, to have them approved under Medicare for those secondary reasons to make them now for sleep apnea and for less risk in cardiovascular incidents. That's what they're trying to do, and is backdooring it in now.
Yep. Well, there's no doubt in my particular example, I was on 1,500 milligrams of metformin for 15 years, and I'm off my metformin altogether. My sugars are perfect, and that's a side effect of the Munjaro.
It is.
Which is an incredible thing.
It is. Now, let me tell you another thing about Medicare.
Okay.
And Part D, specifically. D for drugs, people. All right. So in a basic plan, those sponsors that have the Part D plans have to have specific guidelines. Okay, so number one, they have to cover the big 6 classification of drugs, and they are anticonvulsants, antidepressants, antipsychotics, anti-neoplastics, which is for cancer, okay, and then also anti-retroviral and immunosuppressants. They have to cover the drugs that are in those classifications.
Okay.
Once you're outside of that classification, they are only responsible for covering at least 2 drugs in any other classification. So we'll talk about diabetes because that's not one of those that I just spoke about.
And everybody has it seems like.
So many people have diabetes, but there's so many options available for diabetes. Jardiance.
Every other commercial.
Oh, okay, I'm just saying. So here you go. Jardiance, we have Trulicity, we have Metformin. So there's all these other options. So the Medicare plans do not have to cover the GLP-1s. You see, for weight loss. They don't have to cover them. Or even the diabetes. They don't have to. Because you have these other examples that I just said for people to utilize. All right? So that's another problem that we're facing. United Healthcare and Florida Blue, because I'll just talk about Florida, that's Blue Cross and Blue Shield in Florida.
Right.
They make you go through an authorization step program before you could even get on the GLP-1 of the Rybelsus, Ozempic, or the Munjaro. So meaning you need to have the Jardiance or you need to take the Metformin before they'll put you on the GLP. If your physician says, well, this didn't work, we need to move here. So that's how that works with those 2 companies. So there's the option that they put in there. They don't have to put it in there. And that's where you're starting to see a lot of barriers because these drugs are expensive.
Yeah, even with...
Okay, it's not cheap.
Yeah, I have friends who have told me their medication, their Munjaro, is covered under their major medical. I'm not talking about Medicare right now. And then they get the good news. Yes, it's covered. And then they go to the pharmacist and find out it's $900 with the coverage a month.
Yep. It's very, very expensive drugs. So As an example, the Rybelsus, the Ozempic, and the Munjaro, we're talking about the net, not the list price, is just under $300 a month for a 1 month supply right now. Okay, for those drugs. On Medicare, a lot of the plans, you're going to average about $47 to $60 a month for a 30-day supply.
Oh, wow.
If you don't have a deductible. If you have a deductible, you will have to pay the total cost, close to that $300 before you hit the deductible. And once you meet the deductible, then you would pay that tier pricing of $47 to $60 a month. And then, of course, in 2025, Medicare added that maximum out of pocket of $2,000. So that's the most anyone would pay for their prescription D drugs on Medicare. So that's the most anyone would pay for the entire calendar year. But these are not cheap, people. Okay. And the Wegovy and the Zepbound, I mean, those are $700 to $900 a month. That's the net price. So now, I mean, that's expensive drugs. If you don't have insurance, how many people could afford that?
No, it's ridiculous.
Okay. I mean, that is insane. So it's important for Medicare to try to, they're looking at this right now. So I told you it was hands off since 2003 with weight loss drugs. Currently, they are looking at the reinterpretation of the policy towards weight loss drugs. They didn't say no and shut the door.
Right.
They just said, not right now, but we're looking at it. That's what they're doing right now. So at least it wasn't finalized yet. They are looking at studies. They're looking at about the number of people who are utilizing it, what the effects are, and all the things like that. And I'm hoping that they're going to turn around and say, yeah, we need to, open this back up and utilize these weight loss drugs that are helping so many people with these secondary issues of diabetes, or if it's going to be with sleep apnea or less risk for cardiovascular incidents. So we're hoping that they're going to open the door because, that's going to affect, as soon as they say, okay, that's 4 million people.
Yeah.
4 million people at least that are going to be able to utilize this drug to start helping with the program.
And again, like you always say, it gets back to the money because there's always that, I hate to use the word conspiracy, but I'll have to think of a better word, but the healthier we are, the less money they make on us with pharmaceuticals. I mean, I've been hearing this since I'm a kid, and when you're young, you go, oh, that's a terrible way to look at things. Don't say that. But, pharmaceutical companies, I don't think, want to cure us. They want to keep us on medication.
Oh, they totally. That's, what they're in business for money. They're not in business to help you.
You don't think that when you're younger.
No,
of course, they're helping. They're this. Come on. Yeah. You get older, you realize, no, they want to keep you not near death, but they want to keep you sick. And then you have the opposite side. You have the insurance industry that wants to get you off of claim. They don't want you sick all the time because then you keep taking their money. God forbid you pay back some of the premium. They pay back some of the premiums you've been paying them. Yeah. It's really a ridiculous scale between the insurance industry and the pharmaceutical industry. One wants to keep you sick, so you keep making claims. Yep. One wants you to be healthy. That would be the insurance world, so you stop making claims so they can keep all your premiums. And I guess that's the constant battle in Congress.
Well, it is the constant battle. And so you're talking about price, and they're estimating that over the next 8 to 9 years, if they did add these fat drugs, specific for weight loss, we're looking at $35 billion, that Medicare is going to have to pay by adding those drugs onto their formularies. Now, that's a big cost in the beginning. It's a big chunk, but you just said it. The insurance companies want you off the drugs. They want you healthy so they don't have to pay out claims or providers. So in the long run, once people are losing the weight and they're getting healthier, it's going to be better for everyone in the long run. Including
Medicare.
Yeah, of course.
But Medicare is already bankrupt. Where's that first $35 billion coming from?
Exactly. Where's it coming from?
China. I don't know why for the last 8 years I say it that way. We won't get into that. China. We won't get into that. Now, we try never to get political, but I have been reading about, and you discussed it with me earlier, a new proposed bill in front of Congress called the Most Favored Nation. Now, talk to us about that.
All right. So, on its face, it's saving probably 30 to 80%. okay, about the cost of medications that we're paying for here
All
in the
medications?
United States. Yeah.
That's incredible.
It is. I mean, they're not, I don't know if they're going to negotiate every single medication all at one time. Okay. They usually do it by the most expensive. Again, it's about money.
Yeah.
All right. So they're going to do that first, but it is a considerable savings. I mean, we talked about how, the diabetes drugs, the Rybelsus, the Ozempic, and the Munjaro are costing just under $300. But outside of the United States, you're looking at $69, okay, to $200, okay, for 1 month supply. So it's a huge difference, okay, for the drug. So it's a big cost savings that we're looking at here. Is it going to happen? There's going to be legal battles. Industry, there's a lot of the people in the industry that are not in favor of this. Insurance and the processes, step management, and what's going to cost them, and that's all going to be on top of this. So it's too early to tell if this is going to pass, or even if it's going through Congress. It doesn't matter.
Yeah,
there's a lot going on.
Now, you started your sentence with, on the face, it looks like what's below the face.
Yeah, that's it. That's what the
problem is. Do we ever
is.
know what's below the face?
Not really. We never know 100%. Right?
I mean, if it was just cutting 30 to 80%, I would assume this would fly through as a bipartisan bill.
I would think
on both sides.
That's right.
Yeah. Now, of course, that being said, Congress doesn't use our Medicare. Congress doesn't use major medical. They have their own program.
That's right.
Again, don't want to get too political about that, but I think the best thing we could do, whether you're a Republican or Democrat, if the Congress had to live with the same rules we did for their Medicare and their drugs, you watch how quick that bill would go through.
Total different outlook.
Yeah,
a totally different
outlook. That's always been staggering to me.
Yeah.
And again, don't want to get political, but when you go back X amount of years and Obamacare was introduced, and again, I'm not going to get political. The only thing that I could think of the first couple of weeks was Congress immediately excused themselves from it.
Yeah.
They said, we don't want to be part of this.
Yeah.
And back then I was more partisan than I am now. Okay, I'm very bipartisan now. But back then I went, well, wait a minute. If they don't want it, why do I want it? And I didn't know anything about it.
Sure.
But boy, was that a loud call to America. This looks great. For you.
Yeah.
Not for us.
Not
I mean,
for us.
What the hell was that?
Yeah.
So is this new bill, it's going to go in front of Congress. Does it have a shot this calendar year of passing anything, or is this going to be something we talk about for the next 3 or 4 years?
It definitely has a chance, okay, because they've already introduced now into Medicare for negotiating drug prices just in general, right? So we're already in that momentum of negotiating drugs. So this would be great to be able to have drugs that are outside of the country, the same prices. I just told you they're so much cheaper overseas. It's definitely benefits our beneficiaries on Medicare here. The problem is, again, we're going to talk about the pharmaceutical companies. We're talking about the money.
Yeah.
So if they're getting, $300 a month right now,
where's their motivation to go down to 69?
There is none.
Yeah.
Okay. They're not going to do this altruistically. They're not going to do it. And this is where we always have these problems, is because the lobbying for pharmaceutical companies and other types of companies. And this is where we hit walls, okay, because it comes down to money. I mean, this is it. I mean, we're just facing the facts. That's really what it's all about. They want to know where they're going to get this profit. Where are they going to regain their profit? And it's going to come back on all the Medicare beneficiaries in one shape or form. That's what happened this year once they introduced the $2,000 maximum out of pocket. The Medicare Advantage plans just turned around and raised premiums. They raised deductibles. They moved drugs around. They're going to do that again. If something like this passes, they're going to be passing that on to the beneficiaries.
They're going to get it from somewhere.
They have to. That's what they're going to do. There's no doubt about it. So that's what we're in for, folks.
It seems to me like not every shopping center, but more shopping centers than usual have Canadian pharmacies. And I have friends that get their normal pharmaceuticals from Canadian pharmacies. Does Medicare cover when you get something from if something from CVS or Walgreens cost X and Medicare is covering X,
Yep.
and that client goes to that that patient, that person goes to a Canadian pharmacy and it's that much less. Medicare likes that, right?
No, that's not covered by Medicare at all. Okay, because you're importing drugs from outside the United States. That's actually a violation of federal law. So it's such a weird catch-22 right now. So you have these Canadian pharmacies. They have other names that are similar to that have storefronts here in the United States.
Yeah, there's one by my house in a shopping center.
You just can walk right in, get a prescription from your doctor, and then these are the liaisons between the pharmacies and you. Okay, and they now are going to import the drugs here into the United States, which is against federal law. But most of the time, the federal agents are kind of looking for the people that are buying mass orders of these drugs and trying to resell them on a black market, right? So most of the time, the agents are looking for that. But if they really wanted to bust it on people, they could. They could stop it. Absolutely could. Arrest people. They could be shutting down.
I'm surprised
those Canadian pharmacies,
because they're everywhere. It's just staggering.
I know, they're everywhere.
I just learned that's against federal law.
Yeah, it is. And people ask me about it all the time, and I have a lot of clients that do it, and I go, I just need to tell you the facts. It is against federal law to import pharmaceuticals outside the United States. But like I say the same. Most of the time, they're looking for dealers that are trying to sell mass
it makes
quantity,
sense.
But you got to be careful. It's against the law.
You can go into the local pot store and have 37 different varieties of gummies and weed, but you can't get your Munjaro from Canada at one-third the price.
I know.
It's a strange world.
I'm telling you.
It's a strange world.
It's crazy.
We discussed so many things when you were here 30 days ago, which obviously was very popular because of all the thousands of views. There's stuff coming, and it doesn't seem like it's good stuff. Is there any, before we go over more changes, because I know this rolls off your tongue, this is your expertise, is there anything good coming? I remember a couple of shows ago on the TV show a few years ago, you came on one show and had nothing but good news. Look, this is going up to this, this is going to do this. Is there anything on the horizon that those of us 65 and above that are, can go, well, that sounds good, or no?
Honestly, there's nothing great coming on the horizon. I'm only seeing
go to the gym, lose weight. That's what she's saying.
I'm only seeing repercussions coming back to the Medicare beneficiaries for 2026 because of the money that these companies are losing. So I'm only seeing higher premiums, higher deductibles. Medicare will set that, and then higher copays and less additional benefits. So when we say additional benefits, we're not talking about the Medicare benefit, which these plans, Medicare Advantage plans, have to cover. We're talking about like your hearing, eyeglasses, and dental, the Silver Sneakers program, which is another tool,
I didn't know that was still around.
Yeah, that's still around.
I didn't know that.
Absolutely it is. But these companies have got to recover and recoup their profits. So in 2026, I'm not seeing great things ahead for Medicare beneficiaries.
So it always gets back to education, calling a person like yourself and going, okay, which direction do I take? Then another thing I want to ask, you say recovering the profits. Correct me if I'm wrong. It's redirecting that. They're still humongously profitable.
Humongously. Anytime you see a commercial on TV, they're doing darn good.
They just don't want to make less. And as an entrepreneur, I'm not putting that down. I'm doing this podcast, and I want to monetize this podcast, and I want to help people. But I'm not going to lie that I'm not making money and want to make money. That's what makes America great. But these companies that are making billions, and if they do they make a little less. They feel so obligated to make that extra back on another channel somewhere.
That's right.
Through people. And, God, that's just, I don't know. There's a line to capitalism, and I'm about as capitalistic as a person can get. But where's that line between capitalism and just pure greed?
Yeah, it really is. If you look at it in these big companies, the salaries that these CEOs are getting, right? How much do you need?
I need a lot.
We need a lot more, but they could use a little less.
And how about the companies that are doing badly And the CEOs are still getting their 10, 20, 30, $40 million comp packages.
There you go.
Or they're fired for taking the company down the tubes, and they have their golden parachutes.
There you go.
To give them, can you imagine being paid in our world for failing?
Yeah.
And yet they are. Well, again, another show entirely, but look what happened to Wall Street in 2008, 9, 10.
Yep.
Almost destroyed the country. And again, don't want to get political, but I'm going to say it anyway. Not one person has ever gone to jail for what happened in Wall Street. It was pure dishonesty. It was pure greed. And yet not one person has served time. Bernie Madoff served time for a pyramid scheme.
Yeah.
That really had nothing to do with the recession. And he deserved to serve time.
Absolutely.
Yeah. I mean, yeah. Martha Stewart.
Yeah, Martha Stewart.
Martha Stewart. Yeah, she was making license plates for a while. It's just staggering to me. And, I won't get out. I'm going to let you take back over because this just kills me in the greatest country in the history of history. I mean, as screwed up as things are right now, and on the tip of everybody's tongue is, the immigration problems and should we have a wall, should we not have a wall, blah, 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 who cares? But the truth of the matter is people run, jump, swim, crawl to this country to live the American dream. We are still that country, but the greed level is now staggering. It's now way past what our fathers and grandfathers came to this country for, at least our grandfathers.
It's true.
So
no doubt.
What else is coming? You have lots of notes there that actually scare me.
It scares you? Don't be scared. So our seniors, our Medicare beneficiaries, unfortunately they do get treated differently. Mm-hmm. Than other people. I mean, there is some discrimination, in there. And for overweight or obese seniors, they get treated differently. All right. And obesity, when you're an older person and you're on Medicare, they look at it like, you're old. Why are you even worrying about that? Okay. Why are you even worrying that you're overweight? They get dismissed a lot. Mm-hmm. Okay. And that is not right. Okay. Because they hurt. Okay. They have lots of feelings, and for people to treat them like that when they are trying to lose weight and want to get healthier is very, very important. And let's just face it, once you're over 70 in America, the health profession just totally treats you
differently, yeah.
That's it.
I know.
They don't want to do surgeries on you anymore. They don't want to try different types of plans to help you with your conditions. It's just like they write you off. Did you ever see the movie Logan's Run?
No.
In the 1970s with Michael York. I don't even know why I remembered that guy's name. He's an actor.
I remember the movie, but I didn't see it.
Okay, you need to watch it. So I won't give you like the ending, but the premise is when you hit 30, okay, there's a change of life. And you have to all gather in this gigantic coliseum, and you're going to go to a very special place.
Uh-oh.
Yeah.
Yeah.
That's the movie, okay? And Michael York plays a cop, okay, who has to go after people who are trying to run away because they don't want to go to the next place, the next level. They don't want to go. And he's got to hunt them down, and she's almost like a bounty hunter, right? And bring them back so they could, do their thing in the next phase of life. You got to watch it. That's what I feel like our elderly are like now.
Well, and we talk about so much, and the whole premise of 62 Who Knew is living longer. Yeah. The scientific breakthroughs in medical technologies that we've seen the last 30 years are incredible, 30 or 40 years. But they're going to be dwarfed by what's coming down the road of what, living to be 100 in the next 10 to 15 years is going to be everyday average.
Yeah.
Let alone one. Well, that takes this problem or these problems that we've been discussing and exasperates them even more. Doesn't help. I mean, the double-edged sword of longer lifespans, if we don't get our shit together here, is going to be a lot of suffering, and it's not supposed to be.
No, it's not supposed to be a lot of suffering, and that's why the medical profession, you see outstanding changes, in that profession. I can remember when my mom, in 1991, on the day of the, Iraqi war, Okay, I remember that because that's when that started, that day. And she had open heart surgery, and they literally cracked her chest open, and it was a whole huge thing. And it took her like a year and a half to recover. And then 20 years later, she was having surgery. They like went in between her ribs and did something, and it was
Was
like,
that called arthroscopic? Well, am I saying it right? Arthroscopic,
well,
so they.
arthroscopic. Yeah, I mean, similar to that.
Now we have robots doing surgery.
Robots doing surgery. Yeah.
I mean, real stuff. Yeah.
I know. It's changed dramatically, and it's going to change again in the next 5 years, the next 10 years. But with the weight loss, it is very, very important.
Yeah.
But a big thing for Medicare and for just the way everybody thinks about obesity is that they never thought about it as a disease.
That's right.
So for so long, it was that's cosmetic. And listen, you lazy SOB, get off the couch. Okay, stop feeding your face. You're a closet eater. You know, all the things that people will say. And they didn't realize that it was really a disease. And it wasn't until 2013 where the AMA, the American Medical Association, classified obesity as a disease. And that is what started and spurred this entire movement of helping with the anti-obesity medications and programs and things like that. So now that it is classified as a disease, this is something that Medicare should be looking at in reinterpreting, their classification of weight loss drugs. And I'm hoping they're going to reinterpret the final decision and put this back in so that people can get the treatment that they deserve. I mean, we treat... Finally, mental health issues, we've come such a long way with that.
Look how long that took.
I know. It takes a really long time. And, you talk about yourself, Michael, and how you've been on the Munjaro. I'm an emotional eater.
Me too.
I mean, I have no problem saying that because I just know it. And whether I'm angry, sad, happy, whatever emotion, I love to eat. Okay.
That's how I am.
And
when I'm not on the shot. Yeah.
Yeah. And growing up, I mean, that food was everything. That was a big family thing growing up in Brooklyn, New York. I mean, family dinners and on the weekends and the grandma and the sauce on the stove and everything, blah, blah, blah. Food was food. And for me, it's very difficult. I love to eat, and it's been very hard for me.
Yeah.
I had lost the weight, gained the weight, lost weight, like so many people, right? There's so many people that have been on that roller coaster wagon too. It's really important that we remember that lifestyle is incredibly important. Having a healthy diet, exercising, and utilizing some tools like the Munjaro, Ozempic, and the Ribelsis that was used for diabetes but helps with the weight loss. It's a tool. It's not in place of.
That's what
and
worries
you brought
me.
this up. Okay,
That's
you
what
said
worries
it.
me.
Yeah. So, go ahead.
No, I am worried. The doctor said they're going to, when I lose this last 25 pounds, that then she's going to take me from 10 milligrams down to, you don't just stop, down to 7.5 for a month or two, then 5, then 2.5, and make sure that I maintain the gym and make sure that, I am worried about that. I'm worried about that when I'm not taking the shot, I'm going to, mug a Girl Scout troop for 3,000 boxes of Thin Mints and just, gorge her back down. I am, there's no way to, I am enjoying the gym. I'm enjoying wearing clothes that, are a little more attractive than my fat clothes. I threw away most of my 50-pound heavier clothes to make sure that I don't need them again. But it's very dangerous. And there's other issues that are connected to it. I have back issues now. I mean, I'm falling apart all because of my obesity. And, that's a rough word, obesity. But I think if I remember correctly, if you're more than 10% above your ideal weight, whatever that is, you're obese in this country. That's what the insurance companies consider obese.
A lot of them go by BMI.
My BMI is
mass index, body mass index.
I don't let anybody do that.
On Medicare, it's over 30%. So if your body mass index is over 30%, and your doctor figures that out, and then they talk to you and tell you have to lose weight, well, now you're obese. That's how they do. That's how they classify you as obese.
Yeah, I wouldn't even let anybody do my BMI. I mean, even now, I'm 235 now. Actually, I started at 292. Yeah, I'm 235 now. And I want to be 208. anything.
There you go.
201 would be incredible. 209, I'm going to have a piece of lasagna
There you
at
go.
209. But the back issues and other issues that come with being obese that are all connected, even though I'm losing the weight and I'm at the gym, I'm now suffering from. I mean, I'm got issues, and all based on 15 years of being fat, obese. Yeah. It's an old Rodney Dangerfield joke. I went on the scale, and I got on the scale, and a little card came out and said, please, one person at a time. But that's what it was at 290 pounds. I mean, you went into a store and you looked at a double extra large shirt, and it was too tight. And if you're going to go to triple X, which is what you do at 290, you go to a special store or a special section. And truthfully, that was depressing. And when a person that loves food gets depressed, you know what they do?
They eat more.
They eat.
I know. Exactly right.
You watch those movies, Austin Powers. That's your generation, right, Anthony? You remember Fat Bastard?
Fat Bastard, yeah.
Well, one day when he was being very sad with Austin Powers, this is like 15 years ago, he said to Austin Powers, I eat because I'm fat, and I'm fat because I eat. And I remember turning around to my grandkids going, wait a minute, that's me. That's me. I eat because I'm fat and I'm fat. It was very deep, but it's the truth. Obesity, you can't get away from it.
No.
You walk by a mirror, you walk by anything with a reflection. I mean, I just started tucking my shirts back in. 3-4 months ago.
Yep.
And I certainly do not look slim, but at least I can tuck my shirt in again.
Yes, that's right.
And that gives you a certain amount of pride and stops you from grabbing the wrong food. Mm-hmm. But very emotional when it comes to obesity and fat.
I'm with you. I totally understand. That's where I am. I'm the emotional food eater. And it's very hard to do that on your own. It really is. When you've been used to your entire life for every single emotion eating food, it's very hard if you're feeling an emotion to not eat.
Yeah.
It's so hard.
Yeah.
And I know there's many of you out there that understand exactly what Michael and I are talking about. Totally understand what we're saying. And for me, it's really hard because it's every single emotion.
Yeah.
It doesn't matter if I'm happy or I'm sad or I'm angry or I'm scared. It doesn't matter.
Yeah.
I got to eat.
I absolutely. I think most of the world is that way. And then you talk about our upbringing, and you brought up dinners and stuff. In New York, I'm from Queens, and we came from a neighborhood that was basically all Jewish, Greek, Italian, Irish. And I remember I talk about this with my sister every now and then. Every day, 7 days a week, my mom had several candy dishes on the end tables and on the coffee table, and there were M&Ms in there. There were Hershey Kisses. There were non-Pariels. Remember the things with little sprinkles?
Of course.
They were always out. You walked by, you grabbed one or two.
Yeah.
Nobody ever thought back then that you shouldn't be eating Hershey Kisses every day.
No.
Really and truly.
All right, I got to tell you, have you ever heard of this comedian? He's called Sebastian Maniscalco.
Oh, my God. He's one of my favorite.
God.
Yeah.
Okay,
and
so...
he's Italian. His wife's Jewish.
Okay, so I don't know if you saw this episode, but this has made me think of it. So we always had company. You always had people just stopping by. And so my grandmother used to do this. She used to have an Edmonds crumb cake.
Edmonds.
Okay, I know, Edmonds, all right? And she would bring home this crumb cake, and I loved that crumb cake, and I would want to touch it, and she'd be slap my hand.
Yeah.
Don't touch that. That's for company.
Yeah.
And Sebastian does a whole skit on just that,
He is
and
hysterical.
it just cracks me up. So people, I don't know which one it's on, but you have to watch it. It's about them having a cake, and it's just for company.
Yeah, just go to YouTube and put Sebastian, dessert cake.
Oh my God!
It's just hysterical. But so many of the things.
But it's true.
It
we all had that. We all had to deal with that.
It is absolutely. And back then, also, your mothers, you ate till you're full, and then your mother went, "You done? Keep eating. What's the matter with you? I worked all day for this.
You could not leave anything on the plate.
Yeah, I worked all day, and you're not eating?
And I would there were kids starving in Africa.
Oh, that's what I would get, too.
Well, of course, that's what we would tell you. You're not leaving until you finish the plate. There's kids starving in Africa.
I remember the first time I did that with my kids, different generation. They went, and then send it to Africa, Dad. I'm leaving. I'm going to watch TV.
Yeah, if you and I said that, we would have got beat.
Yeah.
All right. Oh, yeah. Totally another shit.
Different generation.
I
just got the look. I never got hit.
Yeah?
I got the look.
Okay.
And the look from my father Never raised a hand to me. Never even came close.
Wow.
But, I had a great relationship
Absolutely.
with my dad.
I know you did.
And all I had to do is get the look from Dad.
Yeah.
Okay. That's it. Case closed.
And you were good.
Yeah. I didn't,
So we're talking about this emotional eating.
Yeah.
Now, just answer me common sense, all right? This is common sense, people. Do you think going to your primary doctor where they sit you down, put you on the scale, tell you your body mass index is over 30, and they tell you need to lose a few pounds, okay, stop eating the junk food, eat more meat and vegetables, and get the hell out and walk. Do you think that's the proper way to handle obesity management?
It doesn't help.
What would it be? Just name one thing that would be better than that. Anything.
Well, again, if I was a doctor.
No, you don't even have to be a doctor. Just what kind of treatment would be better than that? Anything.
Wow. I mean, again, I would say to the person, you're going to die, okay? You're going to die early.
That's true.
Which is what I was thinking in the hospital those 2 days a couple of years ago. I'm going to die early, not play with my grandkids.
There you go.
So it made me, I don't know anything other than fear that would have brought me to Munjaro and losing weight and back to the gym. I don't know.
For a lot of people, that's true. So fear would definitely be one of them. Some people, the way they learn, they visual or whatever it is, they need to see things. So maybe a dietitian who could sit down and just explain to you why it's more important to be eating vegetables and meats and certain number of carbs as opposed to Lay's potato chips.
Entenmann's.
Okay, yeah, Entenmann's or Hershey Kisses. Okay, and they could sit there and explain to you about it, right? All right, or some people like to go to therapists, right? Licensed therapist or psychiatrist. They just need to talk because there's other people that really just want to talk their feelings out, right? Something like that might be much more beneficial. Hiring someone at the gym, okay, or a personal trainer at home, or even watching videos to help you move at home. Okay, nothing is in Medicare like that to help you, okay, with obese management. But here's on the horizon. I don't know if it's going to come to pass, but there's a new bill, okay, that's called the Treat and Reduce Obesity Act, okay? And that's exactly what this act is trying to do. It's trying to really make it a lot more common sense management for obesity by introducing sitting down and having a counseling session with a dietitian, okay? Or if you want to go to a therapist, a licensed therapist or a psychiatrist, or you'd like to be able to go and hire a trainer at the gym, or, have some type of tools and things at home that you can use to move at home. That's what this bill is about, to help introduce all these other measures that seems to be a lot more manageable for obese management than just sitting with your primary doctor getting whacked and beat up all the time.
Yeah,
because that is just useless.
Yeah,
it really is.
It gets to you for about 15 minutes, and then that night you have a healthy dinner.
Yeah.
And then the next day you're kind of like, I'm okay. I feel good. I'm good.
Yeah.
Yeah.
This is way better.
Yeah. Can I have can you supersize that, please? I mean, you think of you think of a big gulp, which I've never had a big gulp, but I've seen them.
I never had one.
I mean, it might as well come with a shot of penicillin or insulin, I should say.
Insulin, yeah.
I mean, oh my God. Yet, not only do we sell them by the millions, but there's free refills, and it's, do we need to be, for lack of better terms, a nanny state? I know there's talk now about, I think it's happened for 30 or 40 years, of forcing schools to serve healthier food. I mean, when I went to school, and I usually brought my lunch. My mom made me lunch, old-fashioned Jewish mom.
Of course.
But but every now and then when I ate lunch at school, this was not the healthiest stuff you'd ever see. It was delicious. I mean, I could eat 3,000 tater tots, but the tater tots, the pizza, the mac and cheese. Of
course.
Oh my God! I think my dad got better food in POW camp during World War II. So probably not. But
all right, so you're happy you're on that Munjaro?
Yeah.
And I, of all the clients that I know that are on this, they like it too.
My sugar's great. Everything's great.
Exactly. So these drugs, okay, that have been utilized for the type 2 diabetes, okay, but is having weight loss, okay, wonderful results. These are lifestyle interventions. It's an intervention for people. And we just got to build that, close the gap now. because, like you said, you're scared to death
Yeah.
about what's going to happen when you're off it.
I am.
Medicare and the health professions and professionals need to do and work together now to close this up to help people so that use this tool, utilize it. But it's not the only tool. We have to put all the components together like a puzzle so that we can make this long term and make it work for everybody. And then we got win-win. Then it's win-win.
And as we get older, our priorities get better. When you're younger, you think. I bought literally every weight gain medicine or supplement in the 1970s and 80s that you can imagine. Joe Weider's protein. Mom had the old-fashioned blender. I put double fudge ice cream in it, eggs. This was even before Rocky.
Yeah.
Joe Weider protein, 6,000. And I just couldn't gain weight. Everybody would say to me through my 20s and 30s, wait till your mid-40s. It'll happen. I go, nah.
Yeah.
I remember sitting down with my dad watching NYPD Blue, our favorite cop show back then, with a quart of milk in the thing and an Entenmann's golden fudge cake.
There you go.
Which is still heaven.
Yeah.
Okay. And a plastic fork. I'm not exaggerating. Wednesday nights, 10 o'clock. During that show, I would eat the whole cake, drink the quart of milk, and never gain an ounce.
I know.
And then something happened in my upper 40s where now if I just walk by the Entenmann's cake in Publix, I think I gain weight.
Exactly.
But yeah, you get older, you get smarter, your priorities change. One of the things I always laugh about, and I guess I'm old enough to say this and secure enough, is, when you go to the gym when you're young, even younger, as a man, I'm talking, you look at the gorgeous women. You just do.
Yeah.
Now, even though it's fun to look at gorgeous women, I'm about 5 weeks away from being 67. I find myself looking at a guy in their 50s and 60s and going, damn, why does he look so much better? I can do that. Now, when you're young, you talk to those people and you find out that they're a gym rat. Yeah, I manage a gym. I'm here 7 days a week. I haven't had a carb since I'm 4 years old.
Yeah.
I was doing curls before I was born.
Right.
You know what? I have a life. I have family. I got to run a company.
Yep.
That was my excuse in my 20s and 30s. Children. I can't be at the gym 5. Now I'm meeting people in their 60s, 50s, and 60s that are professionals like myself, making a good living, but they find that time to be at the gym 3-4 times a week. And the goal that I'm shooting for, and a couple of guys at the gym are doing it, and this is what I'm hoping for when I get off the Munjaro, is Sunday, from Monday morning to Friday at 5 o'clock, strict eating. I'm going to have my omelets. I just won't have toast and potato.
Right.
I'm going to go to Outback and have steak and broccoli. I'm just not going to have a bloomin' onion.
Yep.
From Monday morning to Friday dinner time.
There you go.
From Friday dinner time to Sunday dinner time, I eat whatever I want. Now, I'm not going to be a pig. I'm not going to gouge out.
No, I hear what you're saying.
But if I want to take the kids for pizza, or if I want to go for Italian food and have a piece of cheesecake, so you know what? I'll gain 2 or 3 pounds that weekend. But then Monday morning to Friday again, back on the regular diet, and always at the gym 3-4 times a week. I have a good amount of friends of mine, men and women, in their 50s and 60s that go in. It gets to be Wednesday, and you are just dying for something great to eat. That psychologically to go, I can't have that anymore. I'm fat. 2 more days, I'll eat it on Friday.
Yeah.
And that's going to be my goal when I get off Munjaro, to be super healthy 5 days a week and be happy the other 2 days. I hear you. I still can't put happiness without eating. To me,
I'm telling you,
I haven't mentally changed yet.
That's right. And it's going to be important. But you're making a change just by saying that, Michael. It's a change because you're going to allow yourself to indulge in foods that you have always loved. Okay, you said you're not going to overdo it, but you are going to partake and enjoy in the foods that you like on the weekend only. That's a big change, Michael, because I'm sure before, just like myself, I would have had it any day of the week.
Yeah.
Okay. So I'm working on portion control right now. That's my biggest thing right now is portion control. And I am watching, what I'm eating. I'm not having any Entenmann's cake, or any of that kind of stuff. But am trying to work on portion control, and it's working. Okay, and I am walking, and I am in the gym now. I've lost a total of 30 pounds in the past year.
That's fantastic.
So I'm doing it now. I'm not taking any of the medications right now. I'm not on Medicare. It's very expensive for me right now for that stuff.
You saved me that.
Yeah. So, that's what I'm doing right now. And I'm trying to work on the emotional aspect for myself because I know that's so important. I don't know if I'll ever get there, but I see some changes. You're making changes just by stating that what you're going to do is a big change, Michael.
It's funny with only a couple of minutes left, and you talk about intimates because it was such a big part of our lives. When we moved here in 1975, I hated it. I came down here kicking and screaming at 16, just before my 17th birthday, and just hated it. Came to Clearwater, Florida. We had always vacationed in the Palm Beach, Boca area, which when I do my public speaking, I've said this many times. When I was a kid, I thought it was a law that New York Jews had to go to Boca Raton. I didn't think we were allowed. So meanwhile, for whatever reason, we moved to Clearwater, which in 1974, Diane, was pigs and cows. And I remember saying to my father, what the hell, what did you do to me? And at that time, we went to Skaggs Albertsons. Before it was Albertsons, now all the Albertsons are gone.
Okay.
Are there some Albertsons left?
I'm sure.
Well, it was Skaggs Albertsons.
Okay.
And then Skaggs disappeared. We go to Skaggs Albertsons on Sunset Point Road and Highway 19 in Clearwater. It's our first time shopping, and my dad doesn't do shopping, old-fashioned guy. But when we just moved to Florida, my mom goes, "Where's the closest place?" We all went, and we walked down the cake aisle, and together, my father and I look at each other and go, "Where the F is the intimates?" Seriously.
There you go.
Now we're home that night. Here I'm bitching about cows and pigs, and New York, Jews from Queens see cows and pigs in books and movies. Maybe the zoo. They don't see them on the corner.
No.
And my dad, for that whole day, calm down, you're going to love it here, yada. Now that there was no Entenmann's, I'm not exactly, at dinner, Dad's like, how the hell can there be no Entenmann's? Where the hell did we move? I mean, how can you not? No.
But I hear you. Well, all I can say is that obesity is a disease. Okay, you and I live it. Okay, I mean, we do. We live it, and Medicare. And I'm talking to you now, Dr. Oz and RFK Jr. You need to really push this and help push the anti-obesity medications for people and to expand this program with the Treat and Reduce Obesity Act because it's not a personal issue. It's a health crisis.
That's right.
Okay, and we need to get on top of it and close this gap so we can make ourselves healthier so we can live longer and do all the things we love.
And if people call us a nanny state for that, the hell with it. Then we'll be a nanny state. Let's make people healthier.
Yeah.
Thank you always for being here.
It's a
and
pleasure.
being our national sponsor. And like a very bad host, I forgot my book. But if you want the best Father's Day gift in the world, go to Amazon and look up A Gift from My Father by Michael Banner. It is about the laws, and not laws really, ethics, morals, cliches that the greatest generation used to bring up their sons and daughters and what built this great nation. And I'm such a bad host for not having the book to hold up.
I'm going to put the link in the description.
Oh, we're going to put the link in the description. But if you want to live a happy life and never be obese and be happy, remember these 3 words: buy my book. Okay, go to Amazon and look A Gift from My Father by Mike Banner. Get that for your dad. Get that for your grandfather. Get it for anybody. Get it and throw it away. Just buy it. Okay. Have a great week. We'll see you next week.